Factor IX Human, Recom Thr148, solution, Reconstituted, Recon Soln, is a medication used to prevent or control bleeding in people with little or no Factor IX, which is a protein in the blood that helps the blood clot and stop bleeding. This medication is specifically for those with hemophilia B or Christmas disease. It should not be used for other types of factor deficiencies or problems. Factor IX Human, Recom Thr148, solution, Reconstituted, Recon Soln, is important for people who are at risk for bleeding longer after an injury or surgery, or for sudden bleeding in the joints or muscles without an obvious cause. The daily dosage and optimal timing for taking this medication should be determined by a healthcare professional. Before using Factor IX Human, Recom Thr148, solution, Reconstituted, Recon Soln, it's important to read the patient information leaflet provided by your pharmacist. This medication is given through a vein injection as directed by your doctor, with the dosage based on your medical condition, weight, and response to treatment. If you are administering this medication at home, make sure to learn all the preparation and usage instructions from your healthcare professional. Before using the solution, visually inspect it for any particles or discoloration. If you notice either, do not use the liquid. It's also important to learn how to store and safely discard the medical supplies. Remember, the medication vial and supplies should only be used once and should not be reused. Some brands may require you to limit the amount of blood entering the tubing and to avoid letting any blood enter the syringe. If this happens, consult your pharmacist for details on using a new vial and set of supplies. Be sure to inform your doctor if your condition persists or worsens. And always follow the instructions provided by your healthcare professional for the best results. Some common side effects of Factor IX Human, Recom Thr148, solution, Reconstituted, Recon Soln, may include fever, pain at the injection site, chills, headache, flushing, weakness, nausea, or vomiting. However, many people using this medication do not experience serious side effects. It's important to tell your doctor if you experience any swelling at the injection site, shortness of breath, fast heartbeat, signs of kidney problems, swelling of the ankles/feet, pain/redness/swelling of arms or legs, or new or increased bleeding/bruising. Seek medical help immediately if you experience bluish fingers, chest pain, or trouble breathing. While a serious allergic reaction to this drug is rare, seek medical help if you notice any symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, it's important to contact your doctor or pharmacist. Remember, this medication has been prescribed to you because your doctor has determined that the benefit to you is greater than the risk of side effects. Always follow your doctor's instructions regarding the daily dosage and optimal timing for taking this medication. Before starting Factor IX, make sure to inform your doctor or pharmacist if you have any allergies to Factor IX products or other substances. This medication may contain inactive ingredients that could cause allergic reactions, so it's important to discuss this with your pharmacist. You should also let your doctor or pharmacist know about your medical history, especially if you have other clotting disorders, have had recent surgery or procedures, or have liver disease. If you are planning to have surgery, it's important to inform your doctor or dentist about all the medications and products you are using, including prescriptions, over-the-counter medications, and herbal products. If you are pregnant, Factor IX should only be used if clearly needed. Make sure to discuss the risks and benefits with your doctor. It's not known if this medication passes into breast milk, so consult your doctor before breastfeeding. When taking Factor IX Human, Recom Thr148, solution, Reconstituted, Recon Soln, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. Always keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor first. Some products that may interact with Factor IX Human, Recom Thr148, solution, Reconstituted, Recon Soln, include drugs that help with clotting, such as aminocaproic acid and tranexamic acid. It's important to discuss any potential interactions with your healthcare provider to ensure the safe and effective use of this medication. Remember to follow your doctor's guidance on the daily dosage and the optimal timing for taking this medication. If someone has taken too much Factor IX human, Recom Thr148, solution and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call the local poison control center at 1-800-222-1222, and in Canada, you can reach out to a provincial poison control center. It's important not to share Factor IX human, Recom Thr148, solution, Reconstituted with others. While using this medication, you may need to undergo lab and/or medical tests, such as Factor IX activity tests. Make sure to keep all your medical and lab appointments and consult your doctor for more details. Make sure to take each dose of Factor IX human, Recom Thr148, solution, Reconstituted, Recon Soln, according to your doctor's instructions. If you happen to miss a dose, speak with your doctor or pharmacist to determine the best course of action. Do not take a double dose to make up for the missed one. Be sure to follow the storage instructions provided with the product and ask your pharmacist if you have any questions. It's important to keep all medications out of reach of children and pets. Do not dispose of this product by flushing it down the toilet or pouring it down the drain unless you have been specifically instructed to do so. Make sure to properly discard the product and it is expired or no longer needed. If you have any questions about how to dispose of the product, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.